there is a false sense of security that comes with the annual checkup. Most people believe that if the basic tests fall within the normal range, then everything is fine. And for years, that's the message they receive. Everything looks good. Come back next year. But when we look closely, we realize that this comfortable ritual hides a serious problem. Traditional tests only show changes when the body has already been sick for a long time. It is very common to meet people who spent years believing they were healthy, when in fact they were already carrying silent processes of inflammation, insulin resistance, vascular damage, or early heart disease, all happening without pain, without symptoms, without any warning. And this is not the patient's fault, nor the doctor's. It's the fault of the screening model, which still depends on old tests designed to identify advanced disease, not early disease. That's why this video is so important. Today, I want to introduce you to 5 blood tests that have the potential to change your health trajectory. Simple but powerful tests capable of revealing hidden risks years before any symptoms appear. These are exams that help detect what is happening between the lines at a stage when it is still possible to reverse, correct, and prevent permanent damage. And before we begin, I want to make something clear. The value of these tests is not just in ordering them. It's in knowing how to interpret them, because, unfortunately, many professionals were not trained to analyze these markers in depth. This means that if you don't understand what you're looking at, you run the risk of receiving the most dangerous answer in modern medicine. It is normal. When, in reality, it's not. Let S start with the most unfairly forgotten marker, and also one of the most revealing of early heart risk, O1, lipoprotein A, or LPA. LPA does not appear in the standard checkup, it is not ordered routinely, and few people even know it exists. But the science is clear. Elevated levels of this marker can triple the risk of heart attack, even in young, active, and seemingly healthy people. Imagine someone with a good diet, adequate weight, normal basic tests, and who still suffers an unexpected heart attack. Many of these stories share the same denominator, high LPA. And the most striking part is that this is not rare. About 20% of Americans have elevated LPA, and most have no idea. The greatest danger of LPA lies in its behavior. It acts like an amplified LDL. It accelerates plaque formation, increases the tendency to clot, stimulates inflammation, and can even damage the aortic valve. All of this contributes to heart attacks and cardiac problems that could have been anticipated. And there is a detail that makes this test even more important. LPA is genetic. It does not depend on what you eat, how many times you work out per week, or your weight. If you were born with it elevated, it stays elevated. The good news? You only need to measure it once in your life, and that single measurement can reveal whether you carry a cardiovascular risk that the standard checkup would never show. If there is a family history of early heart disease, before age 55 in men and 65 in women, this test becomes mandatory. Since there is still no specific treatment to reduce LPA, what we do is the most important thing of all. We act aggressively on the other risk factors. That includes blood pressure, insulin resistance, chronic inflammation, and especially another marker that is underestimated by most people, ApoB. 2. ApoB. Now we move into the second test on our list, and perhaps the most revealing of all when it comes to heart disease. The traditional lipid panel measures LDL-C, a number everyone is used to looking at, but that number tells only part of the story. It is possible, and extremely common, for someone to have normal LDL and still be accumulating plaque in the arteries. How is that possible? Because LDL-C measures the amount of cholesterol, but it does not measure how many particles are carrying that cholesterol. And it's the particles that enter the artery wall and start plaque formation. This is where ApoB comes in. Each particle capable of generating plaque, LDL, VLDL, IDL, carries a single ApoB molecule. By measuring ApoB, you are counting exactly how many potentially dangerous vehicles are circulating in your blood. If the number is high, the risk is high. If the number is low, the risk drops significantly. And ApoB reveals something LDL would never show. People with insulin resistance, prediabetes, type 2 diabetes, fatty liver, high triglycerides, PCOS, tend to produce smaller, denser, more dangerous particles. Their LDL may look great, but ApoB reveals what is truly happening: intense traffic of atherogenic particles. When we think about true prevention, not just surviving the next 10 years, but reaching age 80 in good health, ApoB becomes indispensable. In longevity practice, we aim for extremely low values, near the 5th percentile of the population. This drastically reduces the chance of plaque formation, even over decades. And that brings us to the third marker on our list, one that works as a silent warning for metabolic health and also for the brain: homocysteine. 3. Homocysteine. Homocysteine is a natural amino acid produced by the body itself. The problem is not having it. The problem is letting it rise. When levels go up, it indicates that certain metabolic pathways, especially those dependent on vitamins B12, B9, folate, and B6, are not functioning well. And when these pathways fail, homocysteine accumulates. And when it rises, the risk of stroke, heart attack, and even cognitive decline rises with it. A simple way to understand homocysteine is to imagine a pot with steam. A little steam is normal. But when it starts escaping through the sides, it means the lid is no longer working as it should. With homocysteine, it is the same. High levels are a sign that something inside the system is already overloaded. Some people also have genetic variations, such as changes in the MTHFR gene, that make it harder to process this amino acid. This does not define a diagnosis, but it changes how we supplement and monitor these individuals. In general, we aim for values below 10, especially in those who already have risk factors. 4. Uric acid. It is interesting to observe how uric acid has gained, over the years, the unfair reputation of being the gout test. And in fact, very high levels can trigger painful episodes of this condition. Uric acid works like an early alarm. Long before hemoglobin A1C changes, long before insulin begins to drop on the exam, it rises silently, showing that the body is having difficulty dealing with excess fructose, refined carbohydrates, and metabolic stress. Several studies show that individuals with elevated uric acid have a higher probability of developing high blood pressure, heart disease, and metabolic syndrome. It is a window of opportunity, a real chance to intervene at the right moment when everything can still be reversed. But there is a crucial detail. Keeping uric acid below 5.5 mg/dl means reversal of high blood pressure, metabolic improvement, reduced inflammation, and a significant drop in cardiometabolic risk. Another important point: intense exercise can temporarily raise uric acid, which is why looking at a single exam is not enough. It is necessary to observe trends over time. The consistency of the curve says more than a single number. 5. Cystatin. C. A much more sensitive marker to evaluate kidney function than the famous creatinine. Creatinine, which appears in practically every basic exam, is influenced by many factors that have nothing to do with the kidneys. Muscle mass, dehydration, a protein-rich diet. All of this alters creatinine and can create a false sense of normality, or even worse, suggest a problem that does not exist. It is very common to see people with perfect creatinine, who, when measuring cystatin C, actually reveal the beginning of functional loss. This is the kind of alteration that only appears when we look more deeply. exactly how preventive medicine should be. Of course, cystatin C is not completely immune to external interference. Severe inflammation, thyroid dysfunction, and obesity can influence its values. For this reason, the ideal approach is to combine creatinine and cystatin C, a duo that eliminates doubt and shows with absolute clarity how the kidneys are working. Now that we have covered the 5 exams that should be in every adult's checkup, we arrive at the final point, and perhaps the most controversial of all, the exam that everyone does, but that is almost always interpreted incorrectly. I'm talking about the famous ALT, the liver enzyme used to assess the liver. If you look at your lab result, you'll likely see something like normal up to 40 UL. And here lies the danger. These reference values were not created based on healthy people. They were created based on average people. And the average person today, statistically speaking, is someone with excess weight, high consumption of ultra-processed foods, and often fat accumulation in the liver. In other words, the line that defines what is normal is rising because the health of the population is getting worse. Decades ago, the upper limit for ALT was much lower, and when we look at Gastroenterology Society guidelines, we see that it should indeed be lower. For men, something between 29 and 33. For women, something between 19 and 25. But even these numbers do not reflect the ideal when we talk about deep prevention. For longevity, we seek values below 25. And why? Because ALT is one of the first signs of liver stress. Stress that is generally related to insulin resistance and the beginning of the feared fatty liver disease. When this process progresses without intervention, it can evolve into fibrosis, cirrhosis, and even the need for a transplant. And all of this begins in silence. Now imagine the scenario. You do your annual exam, your ALT comes back at 38, and the lab prints normal. You go home calm. But in reality, your liver is already calling for help. They are the window through which we see the future of our health.